And welcome back. We have a guest in studio this morning, Dr. Colin Fisher, a cardiologist at Billings Clinic, here to talk to us today about having a healthy heart. Of course, February is Heart Month. What does that mean? What does having a healthy heart mean, doctor?
Well, as a lot of people already know, heart disease accounts for the most death in America out of anything, and 1 in 4 people will die from heart disease. That's true for men, but also of women now. Most ethnicities are represented there. So it's really important to take a bit of time to discuss this and to make sure we're doing all we can to protect our hearts and to live a healthy life.
Yeah, if you feel like you have a symptom or maybe your heart's not, maybe it's not ticking very well. I don't know. What do you think? What would that look like? What would you feel?
So reasons we'd want to see people would be somebody who's having chest pain, especially if they're having chest pain with exertion, with physical activity, increasing shortness of breath, trouble breathing, swelling of the legs, heart palpitations or passing out is something we definitely want to see people for.
Oh, goodness.
But there's a lot of atypical symptoms. A lot of people know that the elephant on the chest. If you have dizziness that's onset and unexplained, or nausea, or upper back pain, or things like that, that can also mean a heart attack. So people have to keep an open mind.
Be scary, and stuff like that, it hits people differently. But you can work to prevent stuff like this, right? And that's probably a conversation you have all the time with patients.
You can. Yeah, these days there's something called shared decision making, and so we like talking to our patients and getting their input on what's important to them rather than just saying, do this because I say so. And so risk factors for coronary artery disease, other forms of heart disease would be diabetes, high blood pressure, cholesterol, obesity, and smoking. And there's an interesting study about 10 or 15 years ago where they took people at age 50 and they followed them out for the course of their life, and they looked at people's risk factors. And it turns out for a male, if you compare a male with no risk factors of all those things I just mentioned, by the time he ends his life, there'll be about a 5% risk of developing heart disease. Somebody with 2 or more risk factors, about 70%. So there's a huge difference that people can make if they just take care, see their doctors, make sure the blood pressure is under control, blood sugars are screened, weight is healthy, and the physical activity is great as well.
All that good stuff. Okay, again, February is the time to do this, so get in and see your cardiologist. Thanks, doctor, for being in here this morning. We'll be right back.